Let's just call Bryan Steil right now.
Hello, this is Bryan Steil.
Hello, Representative Steil. It's Luann Bird calling from Hales Corners again. I'm here with about 50 of your constituents, and we are calling collectively to tell you that we really need you to stand up for health care. We want you to make sure we are all funded. Please make sure you stand up to Trump, stand up to your party even, and make sure that you take care of constituents over billionaires. Thank you.
There's a perfect call.
And said, we got to talk about health care. We knew that open enrollment was happening on November 1st. We knew that people were going to be opening their inbox and they were going to be seeing increases of double, triple, and maybe even more. And they're going to be losing their benefits. So we wanted to provide a place here where people could come and tell their stories. We put these signs to work every Saturday on the corner of 76th and Layton, and I see a lot of my protester friends who stood out even in the rain and cold. But I was quite impressed when JoAnn shows up, and she shows up every week. And then she told me this week of her healthcare challenge. Do you want to stand up or do you want to sit there? Okay, come on up.
Yeah. Okay. I'm not a professional. So, thank you. Yeah. And when I saw him use his phone, I thought I could have done that. put my notes on a phone instead. I did it the old-fashioned way. So thank you, Luann, for letting me tell my story. A few days before, my GoodRx program was to be renewed, which was the first. I don't know how many of you use GoodRx for your prescriptions. I have for about 25, 30 years used them, and I've always been pleased. I saved $350. I have very few prescriptions, and they're not expensive. As a matter of fact, one of them for my heart is free. But the program was I got a text saying the metro market, which is where I have it, is no longer honoring GoodRx programs. They're cutting the GoodRx. I know, I since have found out, because I panicked, and I since have found out that you can get it through Walgreens and other stores. And, and no information where to go. We're just canceling it. And I've had this program, like I said, for over 20 years. And I've always been happy with it. But then I found out about Walgreens. So I went over there, and they were not very helpful. They said, you have to send your prescriptions the doctor has to send us your prescriptions. So, okay, that's understandable. But they gave me no real encouragement. And I have very cheap prescriptions. But on my budget, it makes a difference. And so I think I said last year, they said GoodRx saved me over $350. But when I went to it, and then Walgreens gave me, the problem also is I was out of heart medication. They couldn't help me. So I called the doctor, and at this point, when I was writing this, there was no response, but she did call this morning, and she did help me out. She did some research for me at the different places where GoodRx does continue. What shocked me is the coldness and the callousness that they just said, we're not serving you any longer, with no help as to where to go. So the morning I met with Luann, or the evening, I just got the message, so I kind of panicked. But so anyway, I just wanted to tell you about the program, how they cancel it just off the top of I guess, I don't know. It may have been in the works for them, but they didn't tell me about it, and I panicked. But I'm working it out, and I'm trying not to complain about it. I just say it's frustration, but patience. Frustration, but patience. We got to work it out. So anyway, thanks, Luann.
I'd like to introduce Erin.
I'm going to be talking about Medicaid instead of the ACA. Let's see. I'm just not sure what this big, beautiful bill is going to mean for the people I love. Right now I'm reading a story of my best friend, Emma. We've been best friends since we were in the 2nd grade. We were Snow White and Rose Red in the school play, and her mom made us dresses. We laughed together in school assemblies, and no matter how far we've gone, we've always come back to each other somehow. She lives in a duplex above, in the duplex above with her parents. They live in the apartment below, within walking distance to a park. She does not work, but occasionally volunteers their art schools to the Grand Avenue Club. Medicaid makes it possible for her to afford her medications and medical appointments, such as their GP, their psychiatrist, sorry, it's in small print, their dentist. Probably should put this down. Medicaid is the reason why they're functioning as well as they are, despite anxiety and schizophrenia. Really, people with mental illnesses are just regular people, like anybody else. We go out in the community and nobody knows either of our diagnoses. Both of us have invisible disabilities. Without Medicaid, they would run the risk of destabilization and homelessness. Currently, prescription drugs and home and community-based services. Just for context, home and community-based services is more like what you'd find in Good Housekeeping magazine than medical care. It's independent living skills, things like cooking healthy meals or knowing how to clean up the house. Currently, prescription drugs are a optional service. You're not required to pay for medications. And honestly, it's already difficult enough for her to get her antipsychotic medications that help keep her hallucinations in check. Depending on what changes we see in this big, beautiful bill, there is a very good chance that services that help keep her apartment sanitary will stop. I have so many questions about how this is going to work. What counts as a disabling mental disorder? How do they prove they're going to be exempt because of a disability? How many hours of care would her mother, an unpaid family caregiver, by the way, who also uses Medicaid, how many hours of care would they have to do in order to be exempt? Honestly, I don't quite understand how this can be a Republican thing or a Democrat thing. Honestly, as far as I know, everybody's got a best friend. So I've just got so many questions. What is this bill going to mean?
Has Bryan Steil been responsive to you? I know you're there all the time. Has he been responsive?
I've never heard from the representative himself. His aides seem very nice. One in-person meeting is a good start, but we need to be in constant dialogue with constituents. And really, all this stuff is not really a Democrat thing or a Republican thing. It's just an everybody thing. Yeah, basically.
Thank you, Erin. Thank you again. Thank you, Erin. And I have another.
My name is Doug Perry. I'm a South Milwaukee resident. I'm a retired teacher and active in the community. I was on a school board in South Milwaukee for 9 years, and just active in the community, blah, blah, blah. Wow, what's some stories already? And we've just heard from a couple of people. Gut-wrenching. Mine's going to be a little more selfish to start with. So I'm on Medicare. I'm an old guy. My wife is a little bit younger than I, so she's in the ACA. And currently, with the subsidies, she pays, in 2025, she was paying $422 a month. And that is $8,000 deductible and co-pays. But you have to have health insurance, right? So she's been looking, as Representative Sinicki said, November 1st. Enrollment period's open. Similar coverage, not exactly the same. First of all, Common Ground, who she was insured with the last 2 years, they're gone. They pulled out of Milwaukee County. They're not making enough money in several counties in Wisconsin, so they're gone. So she has a choice between UHC and Anthem Blue Shield, and her rates will go up without the subsidies. Will go up to $1,167 a month. Now, we're not poor, but we're not wealthy either. We're on a fixed income. We get a little bit from Social Security that is for the cost of living. I think it's going to be 2.8%. But basically, we're on a fixed income. Fortunately, we have a home that's paid for, so our living expenses are low. But that's going to just blow a hole in our budget. Absolutely blow a hole in our budget. We're going to have to dip into our savings. There's no two ways about it. Because we have to. And as someone stated earlier, and I don't know who it was, but someone, when you go to the ACA and you look for a plan, it's based on your age. So my wife is in her 60s, so she pays elevated rate, obviously. The older we get, the more of a risk we are, of course. But we'll have to do it, and we'll have to pay for that. But in the short term, we have to stick by what, I think Ryan said it well, we have to stick and support the Democrats. They can't back down on this. They can't back down on this. We need these subsidies. However, that's in the short run. Who gets these subsidies? Insurance companies. So we're asking the government for these subsidies, which we absolutely have to have. We have to have these subsidies to survive day to day. But they go to the insurance companies. And in the system that we're in, and I see healthcare, I love it. It's not healthcare. It's health insurance. It is. It's not healthcare. It's health insurance. And in this system, there's no incentive to keep people healthy. There's no incentive to keep people healthy. The only incentive is to collect premiums. That's the only incentive. So somewhere along the line, we have to remember, we have to continue this fight. We have to stay on the ground and do what we need to do to get these subsidies, to save Medicaid, what we can of Medicaid, to restore it and increase it. But at the same time, we have to remember there's a bigger picture here. In Sweden, everybody in Sweden pays 7% of their income for health care, not health insurance, for health care. We need, when we're through with this mess, and this will not last forever. This will not last forever. This too shall pass. And when it's over, we have to get better. Single payer, if that's what you want to call it. Medicare for all. whatever you want to call it, that is the only solution to this long term. Thank you for putting this together. Thank you, everyone.
Okay, next up, Donna.
Ryan Clancy. I am that 60-year-old. I don't have the extra 30,000. And Doug, 33 years at South Milwaukee. Thank you for your service. There. Anyway, we connect. Hi, I am Donna Kyler, and I'm here to speak out. 2 years ago, I retired and had my first encounter with the ACA marketplace. This year, my premium actually decreased for about $412 a month using the premium tax credit adjustment. I have a low-level bronze plan, no prescription meds, and about a $9,000 deductible. The premium tax credit is a subsidy for those making under 400% poverty, and that covers half of what would be an $825 a month premium. My spouse, who is 8 years older than I, is on Medicare. 2 weeks ago, I received a notice from my insurer that read, changes to subsidies may impact premiums for all ACA Marketplace members, even if policyholders keep the same plan. When I logged in this last week, I found that my premium increased from about $825 a month to $1,135 a month. I made sure I got the numbers right. $310 more a month for the same policy, but now with a $10,000 plus deductible. The premium tax credit is still in the system of the ACA marketplace. The enhanced premium tax credits have not been extended. In 2026, my spouse and I will need to pull money from our IRA to cover rising costs and to complete a needed home improvement. With this increase in income, we will go off the $84,500 subsidy cliff. Without that extension of enhanced premium tax credits, I will receive no subsidy, and for $13,620 a year, I will be on that low-level plan, that $10,000 plus deductible. This is my not-so-remarkable story. I'm that 60-year-old, but I'm only one. I don't have a spouse who needs the ACA marketplace, so half that. To Bryan Steil. Who do you work for? How are you benefiting? You betray your oath to the Constitution and to the people you serve. You're supposed to serve. You advocated for and you voted to cut health care, to cut education, to cut SNAP, and voted to upend Medicaid. And you voted for us to pay for indefinite trillion-dollar Trump tax cuts for the rich. You and Trump loyalists continue to move wealth and power from the hands of the many to the hands of the rich, cruel, and oppressive few. We resist your betrayal with our voices, and we will vote you out as soon as we can. And with Doug, I'm with Doug. To those who believe government should work for the people, together we can have single-payer health care. We can invest in our future and support child care and education, and we can have zero hunger and no poverty in this nation and in this world. To protect our constitutional democracy, we need to get billionaires out of our government. And to reduce inequality and increase our prosperity, it's time again to tax the rich.
I'm Debbie. I used to be the manager of the local food pantry, and I think it's very important for the clients that I serve that they are able to get insurance. And for myself, as someone getting Social Security and Medicare, they're decreasing health care for regular people, if they're decreasing for these people, then they're coming for Social Security too. So that's why I'm here. as someone who's worked all their life and paid into Social Security, and I was counting on Social Security and Medicare. So any decreases that might come along would affect us. And that's why I'm here. And also for people who receive food stamps. I know what it's like for people that are on food stamps, how hard they work, how difficult it is to get food stamps, and everybody deserves to eat.
I just have one point I want to make, but I want to quick tell my story before I make that point. I'm one of the caregivers for someone who had a very serious accident right before he retired. After 3 months in the hospital and numerous surgeries, he was left with cognitive and physical disabilities and no money. He had spent on every penny he had saved for retirement. So he now was eligible to go for Medicaid and to go into a nursing home. Instead, he joined the family care program, which is a state of Wisconsin program, which is funded by Medicaid, which helps him to live in the community. But with the $1 trillion worth of cuts coming to Medicaid, there's a high likelihood that that program will cut or even disappear, and then he heads to a nursing home. And when I ask myself, what is the sense behind this? I mean, it doesn't make economic sense. It's way more expensive to be in a nursing home. I can only conclude that it's just basic cruelty. But the point I want to make is we've been talking about the federal level, and these cuts are all going to filter down to the state, and it's going to be our state representatives who have to grapple with how this all plays out. I'm lucky that both of my representatives are here tonight, but please don't forget the state of Wisconsin. It's as important as the federal level, and it's going to probably be even more in the future.
My name is Dale Nook. I'm the head of Swing Left Milwaukee, and I want to talk about a personal story and then what informs me and my group right now. So when I was younger, I went into the projects at 5 years old. My mom took care of me with Medicare. I probably would be in a wheelchair, except my mom went and found the best orthopedic surgeon in Milwaukee to operate on both my knees under Medicare. Otherwise, my option would have been go to the county hospital, and I'd probably be in a wheelchair right now. So at 17 years old, I said, I don't want any more help, and this is what Republicans don't understand. People don't want to help. They don't want help. They don't want to be on help, but as soon as they can be off help, they are. So at 17, I got a full-time job at the Postal Service and supported myself, educated myself. Fast forward to now, this is why I work so hard in the community. My group, Swing Left, is focusing on winnable congressional districts. The 3rd district in Wisconsin and the 1st district in Wisconsin. And people from blue states all over the country phone bank, write letters, come up on buses, and they all focus on those targeted seats that we can flip. And the other thing we want to do is take the assembly back at the state. And everybody's helping. We got a great candidate to flip the 21st Assembly District. We made some changes in how the county assigns, and the Bayview team now has the rest of Bayview and the Garden District on our team, and we're going to flip that 21st Assembly seat. If I have to kill myself, we are going to flip that seat. And hopefully we're going to flip the 3rd congressional seat, and we're going to flip the 1st congressional seat, and we're going to get thousands of people from Illinois again to help us. So thank you.
My name is Carol Limbauch, and this is my granddaughter, Chelsea Turk. She's cognitively disabled and has autism. We live here in St. Francis. My daughter is disabled with multiple autoimmune and other physical diseases and mobility challenges. So, of course, they both need Medicaid. They need that. To that end, I bought us a 2-family house in St. Francis, not to be a landlord, but to provide housing and be be there to help each one of them. And my daughter's 46, and I am very fearful of the future for her. I'll be 73 in a minute, and I'm appalled at the direction this country is going in. It's wrong. All of us need to take action. This doesn't affect you, it affects somebody that you know. Perhaps they haven't told you. But the future is at stake here. So not only it's the need for health care, affordable, ACA, prefer single payer in the future, it's also food. You know, the government shutdown is the Republicans' fault for failing to negotiate with the Democrats who are holding out for health care for everybody. Call your representatives, call them often, hold their feet to the fire, talk to your neighbor, use your connections. You can email, you can telephone, do something. It's unethical, unconstitutional, immoral, dead wrong, and people's lives are at risk here.